Welcome to the New Mexico Suncast. I'm Jim Williams with you, my producer Joaquin Romero, and our community relations director for the New Mexico Suncast. Joaquin is he's the guy that works 24 hours a day and takes care of his kids and has to do everything that his wife tells him. So he's an amazing young man. Fred and Paul, you guys kind of do that same thing. I was teasing you before we went on the air that neither one of you take a whole lot of time to smell the roses, but we do appreciate all the work that you're doing. Let me tell our listeners and our viewers about you. Fred Nathan is the founder of Think New Mexico. He's their executive director. He serves on a couple of boards, Santa Fe Preparatory School and Thornburg Foundation. And I should emphasize that this is our second of a series of 3 interviews, but there's going to be a lot of articles produced using quotes and references to the things both Fred and Paul say about bringing back healthcare workers to New Mexico. We're doing this interview because you gentlemen have emphasized to me how important and how urgent it is, because we're very close to the precipice of medical malpractice insurers leaving the state and leaving us high and dry. Let me introduce Paul Gessing. Paul is the president of the Rio Grande Foundation. Their mission is to promote liberty and prosperity for all New Mexicans. And again, I'm just excited to have both of you here. Fred, you are a licensed attorney. You haven't practiced law, but you've been trying to help New Mexico through Think New Mexico. I hope that your attorney compadres are not going to be mad at you, because I think in some ways they think that you're trying to harm their business. But Fred, by bringing back healthcare workers and doing things like limiting attorneys' fees and damages and so forth, you don't really feel that's going to harm their business at all, do you?
No, it might even help their business because there's so many lawyers from other states pouring into New Mexico because our laws are so generous that I've heard that some trial lawyers are very resentful and wouldn't mind a little bit of reform, so it's not so attractive to out-of-state attorneys.
Yeah. Um, let me go to Paul. Paul, does our legislature have the ability? I know there's been talk about a special session coming up as we are in the last couple of days of August of 2025. I haven't heard any details about that or whether they would even talk about any of the topics we're addressing right now. But does the legislature have the ability to put limits on attorneys' fees and compensatory damages and punitive damages when it comes to medical malpractice insurance?
Absolutely. The legislature in New Mexico is quite powerful. They are the policy-making uh, arm of New Mexico government. They have broad authority in our state. And when people talk about this governor or that governor, regardless of party, I am always there to point out that it's the legislature that really controls New Mexico government in so many ways. And certainly medical malpractice reform is one of those ways. They have set different laws over time. In 2021, they expanded the medical malpractice law and increased the caps quite dramatically. They reduced them somewhat in 2023 in certain areas relating to certain practices after a tremendous amount of pressure was brought to bear on them by medical providers. Uh, and they would have the chance to act again, whether in the special session. Now, the governor does set the agenda, but I don't know what the governor's thought process is, but I'm sure that the governor and the legislature, if they thought there was something that everybody could agree on, they would get together in the special session and do it. But they could have done it in the 60-day session early this year. They could have done it at other times, and they could certainly act in the 30-day session that we're going to see in 2026. So the problem is as I understand it, and I know we're trying to be as nonpartisan as possible, but anybody who follows New Mexico politics knows that Democrats, especially in the legislature, have controlled state government for a very, very long time, with only some minor interludes of even Republicans controlling one house or the other. And I'm talking not since 1930 have Republicans controlled both houses of New Mexico's legislature at the same time. So we're talking lifetimes in New Mexico since we've had anything but one party really controlling things. Now, I don't know what medical malpractice was like in the 1930s, 40s, or 50s. I can tell you that it has been a problem, but the trial attorneys give overwhelmingly to one party. That party controls New Mexico, and I consider it part of the three-legged stool of the Democrat Party's, you know, fundraising and political base, alongside the unions, especially government employee and teachers unions, and the environmental groups that are very active and well funded as well. So trial attorneys are one of that three-legged stool, and one of the reasons that Democrats do maintain power in the state of New Mexico, pending voters choosing something different. So that specific issue is somewhat more partisan than the others, this medical malpractice issue, just because of the dynamics of that organization and their approach to governance.
Jim, I would add to that, going back to your original question about the power of the legislature to change these laws. And I would point out that in some of the very progressive states like California, Massachusetts, and New York, they've capped attorney's fees. This should not be a partisan issue. They've capped them in medical malpractice laws. And in fact, in the bill that we brought to the legislature last year, we patterned it after California. In California, they're trying to have a balance, so they cap attorney's fees in medical malpractice cases at 25% if the case is settled, and 33 and a third if the case goes to trial where there's more work. And of course, in New Mexico, we have no statutory limits. So what we're proposing is not the least bit partisan. This is something that's, I think, accepted in other states on both sides of the aisle.
Fred, and I don't know if you know the history about California, but have they done what New Mexico's done? We seem to try all of the wrong ways before we do the right way. And to me, there's not many answers to this. But I do want to bring up that my own observation, not being an attorney, is, for example, I read Brian Egoff's op-ed that he wrote in the Journal last week, and he seems to be saying that medical malpractice insurers, large medical corporations, hospital ownership, and those kind of things are trying to gouge the citizens of New Mexico. And both of you have argued, Paul and Fred, that you don't believe that's the case. You actually believe that the attorneys are trying to get as much, I don't know, freedom as they can to bring as many lawsuits as they can, thinking that might be the most profitable way to take care of their families and be in New Mexico. But Fred, you started our whole conversation today saying you're not trying to put attorneys out of business, and you think that if we fell back to having reasonable malpractice insurance rates, that would be a big part of bringing doctors and medical people back into the state. And that obviously is going to be more procedures done. We've talked about medical malpractice insurance and its cost. Well, I don't know if you saw this. It was posted in Facebook yesterday by Representative John Block. He said today in the Legislative Health and Human Services Committee, I didn't know those committees met in the off season, if you will, but he said Rehoboth McKinley Christian Healthcare Services testified to these specifics. In 2024, they were paying $1.2 million for $30 million in malpractice coverage. In 2025, they paid $1.4 million for just $14 million in coverage. So, Fred, you've said it before. medical malpractice insurance is at least double what it was even a year ago or 2 years ago. And here's the really scary one. In 2026, Rehoboth McKinley Christian Healthcare Services anticipates that they will pay $1.8 million for only $6 million in coverage. And that's at the point where they can't do any more medical procedures, it sounds like to me.
That's right. So let's go up to 30,000 feet and talk about what a medical malpractice system should look like.
Mm-hmm.
And at a very fundamental level, you want to make sure, first of all, that the patients who have been harmed by medical malpractice are made whole. And one of the things that we pointed out in our report is the system is so unbalanced towards trial attorneys that even patients aren't being made whole. One example is the attorney's fees, which we just talked about. It's a zero-sum game. And if the attorneys are paid a higher percentage, like 40%, that's less available to the patient, who's the client, to make them whole. Another aspect of this is we want to do this in a way that doesn't drive doctors away. And the statistic, the medical malpractice insurance premiums are double our neighboring states. And in fact, we had testimony from a neurosurgeon who left New Mexico because of his very high medical malpractice premiums and went next door to Arizona. And he testified that his premiums in Arizona are 1/5 of what he used to pay in Albuquerque. So it's different depending if you're a specialist, like OBGYNs and neurosurgeons get hit very hard. It's not double, it's multiples of what it should be. And so what we want to do is create a system that makes sure at a fundamental level that patients are made whole, that lawyers are paid a reasonable amount, and I will acknowledge that they should be. I'm not against attorneys. In fact, I'm a fourth generation attorney. Everybody in my family is an attorney. I have nothing against attorneys. They play an important, critical role. They should be compensated fairly. But right now, if we're being honest, they're overcompensated. And then we need to create a system that's not driving away doctors or causing them to retire early. And Jim, you mentioned the Brian Egolf op-ed. There was a response by an OBGYN, Debbie Vigil, who's here in Santa Fe. By coincidence, she is my full disclosure, was my wife's OBGYN and my daughter's before she retired early. She retired early, as she pointed out in her op-ed, because the former speaker and some of his colleagues pushed through a bill that raised the cap so high that it spiked her medical malpractice insurance premium to a level that it wiped out what little profit margin she had. And as she wrote in her column, I didn't want to pay money to practice medicine. I adore my patients. I wanted to take care of them. I hated doing this, but I had no other option. I couldn't pay money to practice medicine. I wouldn't have even broken even. So the system right now is so lopsided towards attorneys and against the interests of patients and doctors. And that's why we need to radically change it to address these concerns and make our system more like other states. Even California, which is a very progressive state, has come up with a very balanced system. I would happily trade our system as it is structured now for California's.
And Fred, last question on this topic for you, and then I have one for Paul. In California, are you able to see a doctor more quickly than you can in New Mexico?
Yeah, and this may be a bridge too far for Paul to adopt something from California. But yes, California, there doesn't seem to be an exodus of doctors. Here in New Mexico, we are the only state between 2019 and 2024 to lose doctors. We lost about 248 doctors. Nationally, the number of doctors was a net increase of 44,000. So we're sort of in, and to put that in context, 248. What does that mean? That's about 6 to 7% of all of our doctors in the state, at a time when New Mexico's population is aging. So the demand, and it's aging everywhere, by the way,
Yes.
but the demand for medical services is increasing at the same time as we're losing doctors. So
Paul, what do you know about a group called New Mexico Safety Over Profit?
Yeah, they're a nonprofit organization. I'm not sure exactly what they are organized under, what uh, different code of the IRS they are organized under, but they are a group that has raised and spent, I believe the figure was about $1.3 million in recent legislative sessions to stop reforms to our medical malpractice laws in New Mexico. They are almost entirely trial attorneys that have given to this organization. They were ultimately, and through Fred's great work and his organization's efforts, they were exposed in terms of their donor lists and the fact that they had taken this really hardline position against any reform to our state's medical malpractice laws. So I guess they are the organization on the other side, because it's not just the trial attorneys as individuals working with individual politicians, as is always the case when big issues arise in Santa Fe. They organize, get together, and lobby and push back to prevent, or in some cases advance, reform. But in this case, they're preventing reform, and they've obviously been successful. And one interesting side note, and Sam Bregman is running for governor. His campaign manager is the head of this organization. So it's just a very close knit group of these attorneys. And from an attorney perspective, Fred is definitely a unique character who's not just willing to say privately that this needs to be reformed, but to actively advocate for it. So I appreciate Fred's and think New Mexico's real leadership and strength of character in coming out and saying, "Hey, we need to stand up for what's right." And just to kind of discuss California, I don't do public policy in California. California is a state that New Mexico so often emulates. I wish perhaps we would emulate them on this particular policy issue, because yes, our governor and the legislature have taken many of the policies that California has enacted over the years, but not in this particular area. So I don't know why and how California was able to do what they did in their medical malpractice reform, but New Mexico could actually benefit from following suit and following California in this particular case.
one small clarification, and Paul, you're giving me too much credit. It was actually the State Ethics Commission
Yes.
that filed a 73-page complaint against Safety Over Profits because they weren't following the lobbyist disclosure law. They were trying to influence policy by running full-page ads in newspapers around the state, also using social media like Facebook, and they refused to disclose, as they're required to under law. And the Ethics Commission unmasked them essentially by forcing them to follow the law. They were hit with the maximum fine of $5,000. And when their 43 donors were disclosed, every single donor was either a trial lawyer law firm, and I believe there was one paralegal, also a member of one of these trial lawyer law firms. They represented themselves on their website as patients and as regular New Mexicans. But what the Ethics Commission was able to point out is not a single donor was a patient. This was just really a dark money front group for the trial lawyers. And I commend the Ethics Commission for bringing that lawsuit and educating the public as to who's really behind safety over profits. By contrast, Jim, there's a group out there called Patients Primero. This is a group of patients who are struggling to get health care, to find doctors, or if they have doctors, to get in to see them when they need to. They're now up to, I think, close to 200 members. It just started organically. They have very little money, and they are what Safety Over Profits was pretending to be. And I'm really gratified that Patients Primero has adopted Think New Mexico's entire agenda for how to solve the healthcare crisis in New Mexico. So, not just medical malpractice reform, which they totally support, but joining all the healthcare worker compacts, creating a very large $2 billion Medicaid trust fund to help raise Medicaid reimbursement rates, to keep doctors in the state and to make healthcare more accessible to Medicaid patients. And finally, to abolish this tax on medical services, where New Mexico is one of only 2 states that continues to tax medical services and which providers end up paying because the federal government won't pay it and insurance companies won't pay it.
So, Fred, your organization, Think New Mexico, put together legislation that was covering all of these bases in our 2025 legislative session. You were able to pass, and the governor signed, establishing the Medicaid trust fund to help offset, because Medicaid does not reimburse doctors at a level that's livable. So that's a really neat deal. We can talk about how that's going to be funded and some other things. We did that in our session number 1. People can go to NM Suncast on YouTube or your favorite podcast provider, and you can see that with Paul and Fred talking about it. Now, what was interesting about that conversation is that legislation has been passed. That wasn't Paul's favorite bill, but again, you guys are willing to work together even though there's disagreements, and I want to say thank you, because that's a model for how we should all be. We're not going to always get our way, are we?
I totally agree. And Paul and I probably disagree 50% of the time, at least. And we've never had a crossword. And Paul he doesn't try to embarrass me in public when he thinks I'm wrong about something. He calls me up and talks to me privately about where he thinks there's weaknesses in my argument. And I try to do the same thing with Paul. And when he disagrees on philosophical grounds, it's never hostile. It's never angry. It's never harassment. Like that sometimes you see this behavior in our roundhouse. It's always civil and polite and respectful, and I
Yeah.
really appreciate that about Paul.
And
Here's
I
a
would just say
question
the
for
same
both
about
of you.
Fred. Yeah, we disagree with some of their things. This is one that we largely do agree on, and I think it's an issue that New Mexicans from all walks of life should be active and engaged on because it is so critical to New Mexicans. But where we do have disagreements on the medical provider shortage, we certainly have respectful conversations between Fred and I, and where we have broader philosophical disagreements on other issues and have over the years, which we certainly have. We always have polite conversations, and we're happy to, in addition to trying to implement good policy, uh, also try to help model respective behavior for policymakers, because we know that's not always the case in Santa Fe, and it's certainly not the case typically in Washington, D.C. So, yeah, I have a lot of respect for Fred and his organization, what they do and have done over the years.
Paul, be specific, and I'm going to ask Fred the same question in a minute. You both provide resources for New Mexicans to go onto your websites and get all kinds of information. What do you mean when you say all New Mexicans should engage? I can't help but think about Um, I'm told by various sources that half of the faith community, regardless of what your religious faith is, but half of the faith community is registered to vote in the state of New Mexico. And it would come time to actually vote, especially in the primaries, less than half of those registered voters actually vote. So between right now and the legislative session, what do you hope New Mexicans are going to do?
Go ahead, Paul.
Oh, well, I actually think that the time when policy is primarily made is at election time in New Mexico, because that is the time when we truly get to hold the politicians accountable. But in the meantime, we do have a likely special session and then a 30-day session, and they need to be going to public meetings when their legislators have them. They need to be contacting their legislators in advance of the special session and certainly in advance of the 30-day session. Now, I'm somewhat skeptical about what is likely to come out of the special session, because those are difficult for discussing and hashing out disagreements on big and complicated issues. And like it or not, each component of the medical provider crisis, there are some simple things like taxes and tax reform. Medical malpractice, quite frankly, is a little bit more on the complicated side, even though there are some great models out there. And then there's everything in between. But what the average citizen needs to do is to make sure that they engage with whoever the current elected official is. And if they don't see reforms coming from their legislators, you'll have a House member and a Senate member. And then, of course, we've got a governor's race coming up in 2026. So that'll be a pivotal opportunity for voters to weigh in on these issues. And quite frankly, I think most New Mexicans should probably be just about single issue voters when it comes to this issue, because if we don't have medical providers in the state, we don't have much of a state left. People won't move here. People won't do business here if they can't find the medical treatment they need, because it affects every single New Mexican. So they need to at least engage and educate themselves to the point where they can reach out to those legislators and then engage in the 2026 election. So that's
So
my
Paul,
suggestion. I know Fred's got some mechanisms that he's implemented at Think New Mexico to help people do that.
Yeah, and it's disgraceful that our voting levels are what they are. And when you think about all the people who have lost their lives or risked their lives to protect our democracy, and we have so many people in this country that take this for granted and don't vote. And I always say, to friends and people I speak with, don't complain about the government. If you're not voting, you're part of the problem. So if you want to complain about the government, you need to vote.
I think I mentioned this earlier, Fred. I think that sometimes people, I don't know if this is a self image problem or it's just not knowing the system, but a lot of voters just think, you know, we might think that we're small and insignificant and we don't really matter. But you would say that we really do matter because elections in our state are decided with a very low percentage of the total voters available in our state.
It's interesting you bring that up, Jim, because it's not unusual in New Mexico. These legislative races oftentimes are very close, and there's a state statute. And when there's a tie, and this has happened several times, in the last couple of decades, where the two legislative candidates had a tie election, and I think they either draw cards, maybe Paul would know, but in statute, there's a way to decide this election because it's obviously very expensive to have another election and not really practical. So I think they draw cards and I think a judge officiates, and that's happened several times. So if you don't think your vote counts, think again.
And let's take an example. Somebody mentioned that Sam Bregman, I think this was you, Paul, has somebody as part of his campaign and the leadership in his organization that has something to do with this New Mexico Safety Over Profit organization. And we've already talked about the state ethics committee. Fred said, thanks for kind of flushing out what they're doing. Well, is it time for people during this gubernatorial campaign to go to Sam Bregman and say, what do you think about this? What are you going to do to help us bring back healthcare workers to our state? Is that something that Sam Bregman he'd probably have to have a lot of courage to buck the trend of the trial attorneys and do something along the lines that you've discussed?
All candidates, but Democrats and Republicans running for governor, need to be asked that question, and whether they think we need medical malpractice reform in New Mexico. And I think the answer would be probably very telling. But I hope we're going to get to the point where we all agree that yes, and stop the denial that there's not a doctor shortage, which we've encountered a lot with the political class.
I
Um,
know Paul's printed out a lot of things that New Mexico is either at the bottom of the good list or at the top of the bad list. And we're the only state, as you said earlier, Fred, that's lost medical providers. Our net over the last 4 or 5 years has been negative, and that's alarming that we're the only state to have lost that. When there's models, you've already mentioned California. I know some of our people that neither one of you, by the way, are Republicans. I think Paul's registered as an independent, and
I'm an independent.
are you an independent as well?
Yeah.
But Fred, would it be fair to say that some of your policies are a little bit more left than what Paul would talk about?
Yes. Yeah.
Yeah, and
We're not on one side of the political spectrum. Our sort of philosophy is when you're 49th or 50th, maybe you ought to focus on workable solutions rather than political ideology. So
yes,
some of our proposals are very conservative, some are very liberal, some are just moderate. We just go where the facts take us. But I would say, looking at Rio Grande's work, and by the way, I need to acknowledge that they were on the issue of the healthcare shortage long before we were, and I want to state that in public. But I would say, yeah, sometimes our solutions would be classified as liberal, and we're probably unquestionably to the left of the Rio Grande Foundation with where we generally land.
this is
Well,
our
I would
second.
only
Go ahead.
add or argue that this isn't a problem that's going to be solved with one policy reform. We need a lot of different policy reforms. And while we are often labeled as a conservative organization, none of the solutions to this problem are partisan. And I would go back to that opening statement that Fred made. Yes, because they've controlled the state for so long and currently have a total lock on every elected office that matters at the statewide level in New Mexico, the Democratic Party, it's hard to not blame them for this situation. But one, we're not a poor state. We have a lot of oil and gas revenues. Uh, we have a lot of money flowing into this state. Of course, we have natural beauty. We have great human resources. We just need to harness them and put them to work. And that's a statement Senator Munoz has made, a Democrat's chair of the Senate Finance Committee. And then moving on to various policies. Yes, medical malpractice. Yes, the compacts that would allow people to practice medicine if they're licensed in one state or another. The gross receipts tax, not abolishing the gross receipts tax, but certainly as a starting point, eliminating medical procedures, medical payments from the gross receipts tax. Yes, I would like to see the entire gross receipts tax transformed into a sales tax. I don't think that's too heavy of a lift for New Mexico, considering its very significant budget surpluses. and the permanent fund that we have if the policymakers are serious about it. Yes, we need to deal with uh, the education system to make New Mexico a more attractive place for doctors who also happen to be highly educated. Yes, reducing Medicaid and it's the number of people on it, but also improving reimbursements for Medicaid. So I'm comfortable with both of those as policy solutions. You've seen some articles and some advocacy among folks like, for example, Representative Liz Thompson, who's definitely among the more progressive members of the Democratic Party in the House of Representatives. And she and Brian Egolf as well, former Democrat, former Democrat Speaker of the House. To my knowledge, he's still a Democrat, not the Speaker anymore. Most of their solutions are just in the order of using the oil and gas surpluses to pay off medical school loans for doctors, to pay housing expenses for them and other medical professionals. I'm not saying those aren't potential solutions, but just putting New Mexico taxpayers on the hook for essentially paying doctors to come practice here is not a real or sustainable long term solution. We also need to address these very real policy obstacles. New Mexico has often fallen into the trap. I'll throw the film industry out as one example of this, where we try to develop our economy by just cutting checks to whoever we want to come here. And that's by no means the only example. It's just one that's relevant here. We definitely need to address the policy climate. We're not likely going to solve or address all of those aspects in the next few years, but we do need to really act to do something. And I think we can agree on that, and most New Mexicans can agree on that.
But Paul and I would agree about or disagree about the loan repayments. Almost every state does that now at this point, and ours really isn't competitive in New Mexico relative to just our neighbors and the rest of the country. So um, there's a bidding war now out there, and I think we have to be pragmatic and probably be more generous with our loan repayment program. The way it's currently structured isn't really very effective.
Well, again, I'm not saying no to that. I'm saying that that can't be the only thing we do.
Oh,
And
that's fair.
we have a tendency in New Mexico to do the thing that's easiest rather than the thing that actually is necessary. And, again, we hear from our friends in the legislature and the governor, and, they like to claim that we don't have resources, that we're a poor state. We do have the resources to expand the loan repayment system, and that's not a problem for me in the Rio Grande Foundation to do that. But it does need to be part of a much broader and more aggressive reform effort that includes medical malpractice, Medicaid, taxation, et cetera, et cetera. Those issues need to be addressed.
Yeah,
I
I
don't
agree
I don't
with
have a
that.
lot of political experience other than talking with folks like you, but I do want to make a statement that I have a lot of experience with looking at financial statements. I'm a retired commercial lender, and I think that the difficult thing is no matter what we do to reimburse doctors for the education that's very expensive for them to become a doctor, it sounds like a great idea to put together a competitive system. But if after you do that, you can't afford to practice in New Mexico because your malpractice insurance premiums are so high, you'll lose the whole thing. You'd rather go to another state where you can have your loans repaid and you can practice and make a profit and take care of your family. And I always want to point out to people, doctors, lawyers, all of these different people are actually business owners, and they might work for another company, but the bottom line is you have to make more money than you spend. And that's also true for your nonprofits. Even though you're a nonprofit, Fred and Paul, you guys have to make more money than you spend, and you're supporting staff people and offices and other kinds of things. So the fact that people make a profit is not a bad thing, and that's why I think it's kind of a misnomer to name your organization, New Mexico Safety Over Profit, because you're not really providing safety for anybody, and the only people making a profit, it would appear, is the trial attorneys. Let's talk to conclude this segment. We're going to have a third segment that people will be able to see in a few days. And in that segment, we're going to talk about some of these loan repayments, how you get your education. And we're also going to talk about the compacts and how states around the country are recognizing medical licensure from other states. So that's what we're going to talk about in our third segment. But you've both brought up gross receipts tax. And I want to make sure that our listeners and our viewers understand that. So, right now, if you go to buy a toy for your child at a local store anywhere in the state of New Mexico, and I know that different counties have different tax, but for example, in Bernalillo County, when you buy that toy, you're going to pay 7.875% gross receipts tax on that toy. And that is going to be charged to you. The retailer is going to be responsible for collecting that money and sending it to the state. But it's different, isn't it, for doctors, because they are not allowed to pass that cost on medical procedures to their patients. How does that actually work?
So about 2/3 of patients are either Medicaid or Medicare in New Mexico. The federal government will never pay state taxes. That's just a rule. So if you're a doctor and you're practicing in New Mexico, you have to charge the state gross receipts tax. And if the payor, the Medicare and Medicaid, won't pay it, you have to eat it. And what doctors tell me is, because I was saying, the gross receipts tax is about 7 or 8% across New Mexico. And they point out, if you're a doctor, yes, you have to pay that tax and cover it for your patients, but you also have to pay the expense of collecting it, reporting it. So really, when you put pencil to paper, it's about 10% of you're paying essentially 10%.
Mm, wow.
You would not have to pay that in any other state except for Hawaii. Hawaii also has a tax on medical services, but they cap it. I can't remember if it's 4.3 or 4.7%, but significantly lower than New Mexico. So if you're trying to recruit physicians to New Mexico, you're starting way behind the eight ball. And it makes it very, very difficult for us to attract physicians because they're starting 10% down compared to any other state they would move to.
Now, Paul, the next legislative session coming
Well,
up
hold
in
on.
January.
Let me jump in here on the
Okay.
GRT. I want to
Okay.
provide a little background and context and a few additional thoughts on that because it is important. One is the history of the GRT goes all the way back to the Great Depression when governments, in a time of dire economic need, depression, really wanted to generate revenue. So they came up with this gross receipts tax, which was charged on everything, including your personal incomes, because the idea of gross means kind of all encompassing. So your total receipts. We didn't have a personal income tax at the time, so the gross receipts tax was charging everybody on everything. I think it started about 2.5 to 3%. I don't remember the exact number. Over the decades, for reasons both good and relating to special interests, that tax rate rose and various things were carved out of the tax. For example, we came up with a separate personal income tax. So no longer were you taxed on your income on the gross receipts. But you are if you are working as a contractor in New Mexico, and doctors are in many ways like contractors. working for the patient. That's functionally the way it works. So that's why they have been stuck with this heavy taxation. That, and they also purchase lots of goods and items that uh, are taxed under the gross receipts tax that aren't necessarily taxed that same way in other states. Under Bill Richardson, insurance company payments to doctors were exempted from the gross receipts tax specifically. So that was a step towards reducing that tax burden, but deductibles and copays and various Medicaid expenses and other receipts for doctors remain under the gross receipts tax and must be paid. At the Rio Grande Foundation, we have long argued for completely reforming the services, the business services provisions of the gross receipts tax to make it much more of a sales tax. Jason Harper, state representative, now retired, was in the legislature the primary expert on that issue, and he, nuclear physicist at Sandia National Lab, really studied this issue, and that was kind of the level of intellect that you need as a legislator to fully understand the challenges of the GRT throughout New Mexico's economy. Now, our preference is to fully reform that tax in all facets of New Mexico's economy. Obviously, for the medical provider issue, focusing on doctors and payments to doctors and things that doctors have to purchase is the simple solution, but I think it would behoove our legislature to consider full repeal. There's various reasons why we wouldn't change the name technically, because of all of our bonding capacity is under the gross receipts tax name, not the sales tax name. And I know that gets in, we're getting into wonky territory here, but functionally, yes, we need to dramatically reform or simply move the state to a gross receipts tax that is really a sales tax. And that would be a big, big step forward for the medical provider shortage and solving it in New Mexico.
You know, a few years ago, they stopped charging gross receipts tax on groceries. And I think
Indeed.
that really helped a lot of New Mexicans. That basically made your grocery bill 8% less than it had been the day before, right?
I agree. You know, I think good tax policy is not to tax necessities like food, like medical services. And it really, you know, if you again go up to 30,000 feet and try to envision what a tax code should be, you would never tax those things. But it's because, well, we've always taxed it. So it must be the right thing to do, which is just completely wrongheaded. Now, you don't want to talk about grocery tax because I think that's something where Paul and I disagree. Or
Well, we don't disagree. We have a nuanced approach to the grocery tax, and that is really not fit within the confines of this particular conversation. But we have nuanced uh, opinions on that, and like I said, it just doesn't fit in this conversation. But yes, that was another gross receipts tax reform policy that was enacted under uh, Governor Richardson. So suffice it to say that it happened. It is still discussed in the legislature. I don't see them reverting to the prior policy, and that's certainly our preference as well as Fred's, that the legislature does not reimpose the tax on groceries. Uh, like I said, going to a straight sales tax, you could put food under that, or you can keep food out of that. Especially at this point in time, given New Mexico's vast resources, we are pleased to keep the gross receipts tax off of groceries, and you know have that discussion at a different time. But yeah, it's a serious issue in New Mexico, and it's really unique. I call it the original sin of New Mexico tax policy, the gross receipts tax.
Well, I want to let our viewers know you can go to nmlegis.gov. That's the New Mexico legislative website. You can, by your address, or if you know the name of your representatives, you can find both your representatives in the House and the state Senate. You can see profiles on what what they voted for in the past. You can see bills that they've written, and you get contact information there. Fred, you've said sometimes that sometimes representatives like calls to their office, even maybe more than emails and those kind of things. And that information is all available. Um, One last thing is to have Fred tell us what resources are available on your website, thinknewmexico.com.
So we published a 56-page report on how to solve the healthcare shortage in New Mexico. And you can just download that report from our website. And there's lots of other information about how to contact your legislators. We have pre-scripted letters that you can write. We always encourage people, because we have no pride of authorship, to talk about your lived, erase what we wrote and write about your own lived experience. So those are two things. You can get the report on our website, or you can contact the governor and your legislators by going to our website and going to the Action Center.
Yeah, and I gave the website wrong. I'm sorry. Thinknewmexico.org. Thinknewmexico.org. Paul, your website is riograndefoundation.org. What resources do you have there? And I know you also have Errors of Enchantment.
Yeah, we have two policy papers, not because we're trying to outdo Fred with the number of them, but one of them was written to illustrate the state of the medical provider shortage, because you do have some in the legislature and others who question the medical provider shortage and whether it actually exists. This is a real issue. Anybody who tries to find an appointment, especially with a specialist, especially in rural New Mexico, but certainly by no means limited to rural New Mexico, can find out for themselves. But until you try to make the phone calls, until you try to set up the appointment, you may not be aware of the depth and breadth of this shortage. So we wanted to look more closely in one of our papers available at riograndefoundation.org at the existence of this shortage. And then we had our own solutions paper, which we put out in 2023, when it was a hot topic, as it remains in the legislature, although in 2023 they did take more substantive action on the medical malpractice issue, and there remains a lot more to be done. So, yeah, I think both of those documents are an excellent place to start. Uh, and I'm referring to both Fred's report and our report on the solutions. I think if you look at those, you'll see a fair number of things that we share in those reports, and a few things that we either disagree on or perhaps de-emphasize relative to what the other organization has to say. But if you look at both of those reports, I think you'll really have a pretty good understanding of the dynamics of the health provider shortage in New Mexico.
Paul and Fred, thank you both for joining us on the New Mexico Suncast. And we are just so grateful that you have all these resources. And I'm hoping that between now and even the special session, if that's coming up in a few weeks or days, that we can really get voters engaged and do exactly what you've both described. Thank you for joining us today.
Thank you
Thank
for
you.
having us back.